so many people in our society struggle with these issues, whether it's abdominal pain issues, whether it's mood issues. It's so prevalent in our current day and age, and there's so much we can do to help one another to do better. And so I pray that as we take the time with this topic today, that you'll help to instill in us some principles to help us understand. In your name I pray. Amen. All right, so today's talk is the brain-gut axis, establishing the connection. So here's our agenda today. We're going to cover a gutsy history lesson that I found particularly appetizing. The brain-gut axis will be our next topic. Then we'll be covering booty to brain, bottom-up communication. And then what makes a great microbiome, food factors and the microbiome, and finally, stress and your gut. Hopefully we can get through all of that today. All right, so there's a fascinating story from the early 1800s that I want to share with you, and I'm just going to read some of this because it's so interesting. But first, before I get to that, I just want to make a quick point about how we verbalize the brain-gut connection all the time. Perhaps you have recognized phrases like brain farts, mental constipation, butterflies in your stomach and knots, having the gall, spilling your guts, gut feelings, gut reactions, going with your gut, gut instincts, gutsy moves, having guts, gut wrenching, no guts, no glory, mental dyspeptic, and my favorite in compiling this list is cognitive impaction. You know? Nobody wants cognitive impaction. That's pretty rough. And so these terms describe what we understand to be completely intuitive, that our brain influences our gut, but we also know now that our gut highly influences our brain. And so it's very important to have an understanding of these things. All right, so one of the first moments of understanding of the gut-brain connection was completely incidental. And this is a story from sciencehistory.org that you're welcome to look at by Catherine Price. It started with a grisly accident that occurred on the morning of June 6, 1822, to a young French-Canadian man who was standing in the American Fur Company store on Mackinac Island in northern Michigan. Alexis St. Martin was 20 years old. He was a strong man who worked as a fur voyager. He was hardy and adventurous and enjoyed paddling pelt-laden canoes from Native American villages to the company's trading posts. As he stood in line that morning to make some trades, someone's musket accidentally went off, shooting St. Martin with birdshot in the left side of his chest from about 3 feet away. It was such close range that he fell over with his shirt on fire and he was presumed dead. The other traders sent for William Beaumont, the doctor, at that time in the area, from the U.S. Army fort, who arrived to tend to St. Martin. Beaumont found that the shot had ripped through several ribs, lacerated his diaphragm and lower left lung, and had put a smaller hole in his stomach. As he treated the wounds and worked on him, the large wound healed quite easily, but this small wound that was connected to the stomach failed to heal. And Beaumont described being able to put his finger into there, and I guess at that time they didn't understand how to deal with that. And so even though he thought he'd die, the man survived. They did multiple surgeries, but this fistula, this hole between the stomach and the skin, remained. And through this hole, Beaumont realized he could watch the processes of digestion. At first, food was coming out of the hole whenever he ate, which was corrected as the wound healed and was eventually covered by a plug. Beaumont decided he would do some experiments on St. Martin. Since so little was known about digestion at the time, he began dangling food on a string into St. Martin's stomach through the hole. Then later would pull it out to observe what had happened. Beef took a couple of hours to digest, chicken longer, vegetables took 4 hours. He found that through the hole, it took different times for different foods to digest. He found that the stomach actually heated up the food some to 100 degrees, but did not actually cook it, which people believed at the time. He found that hydrochloric acid was a main contributor. He found that dry weather increased digestive temperature, but humid weather lowered it. Milk coagulated before digestion. Gastric juice was secreted only in response to food. And did not accumulate it between meals. Hunger was not caused by the walls of an empty stomach rubbing together. And strenuous exercise promoted the production and release of gastric juices. Exercise is important for digestion. But what is most relevant, most interesting, I think, to what we're talking about today is that St. Martin, through these multiple experiments and manipulations, would sometimes get a little angry with his doctor. And when he became upset, and he had a history with struggling with this, his digestion would substantially slow, if not completely stop in a severe bout. And that was the first time after Beaumont published his findings in 1833, Experiments and Observations of the Gastric Juice and Physiology of Digestion. You're welcome to read it sometime. He published these findings, and the beginning of modern gastric physiology and dietetics was born. One quick point of clarification as we get going, and this was an issue for me myself. Everyone talks about the gut these days, and when you think about the specifics, it's like, what are they talking about actually? Because the gut generally refers to the gastrointestinal tract, but when you're referring to the gut as it relates to the microbiome, most of the time they're referring to the distal small intestine and the large intestine, all right? But you have to kind of listen for context and really see what it is specifically they're saying. Okay, so the brain-gut axis. Some people call the brain-gut axis, or at least the brain part, the gut part, our second brain. And, while many wise believe the husband's second brain is elsewhere, the nervous system of the gut, the enteric nervous system, has been called our second brain. And this brings a new twist to the phrase, the way to a man's heart, and it turns out his brain, is through his stomach. All right, so it's amazing. Over 50 million nerves of gut-brain feedback occurring via the vagus nerve. That is the main nerve that feeds gut. That is 5 times more nerves than the spinal cord has going down the legs. To communicate with our brain, gut microbes produce and respond neurotransmitters, which you mentioned, hormones, signaling molecules, and it's very important for these different axes that are starting to be identified in the medical literature. The gut hormone axis, the gut immune axis, and the microbiome gut brain axis, which we'll focus more on today. All right, so we also know that, at least in our society, there's a lot of connection between digestive disorders and mental health. The connection of altered microbiota, which is your gut bacteria, is not only associated with digestive disorders, but also mental health. We mentioned that already. Irritable bowel syndrome affects 10 to 20% of the US population. That's 1 in 5 people. And 70 to 90% of those individuals report having mood and anxiety disorders. All right, not everybody, but many. 84% of individuals with GI disease have anxiety. You hear that? And 27% have depression. All right, so as you can see, this is a depiction that many factors affect the gut-brain axis, because whatever is going on in the gut influences the chemicals that are being transmitted into the bloodstream and through the vagus nerve, as you can see in the graphic, and that influences our brain. So whether it's mucosal immunity, so different immune system factors, antibodies, and different chemicals. Environmental toxins, we know, are playing a role now and influencing our gut. Roundup being the classic example at this point, which seems to be in everything now. Infection plays a role, as we've discussed. Sleep quality. People with poor sleep quality have changes in their gut bacteria and the kinds of chemicals that are going into the bloodstream from the gut. Our diet clearly plays a role, and our genetics. All right, so a few more facts on this. We each have our own unique bacterial population, and we used to think that it was pretty similar from one individual to the next, but it's actually not true. People have their own gut bacteria. It's their very own. You get to keep your own. It's not just the brain interacting with the gut. The gut also interacts with the brain. It goes both ways. The gut microbiota may affect behavior and emotion. We mentioned that. Diets that alter bacteria in the gut may help treat mental health disorders. And we're learning this more and more through the trials that are being done. Mental distress may disrupt the gut microbiota, contributing to bowel disorders such as irritable bowel syndrome. So here's a few of the disorders that have been implicated or associated with disruption of the brain-gut axis. So many of our common disorders today. These are the things that I see every day, almost. From dementia to Parkinson's to stroke issues, to coronary disease, migraines, PTSD, ADHD, stress, IBS, fibromyalgia, infection, autism, bipolar, you name it. Seems like almost everything is involved. There's been a huge explosion of the research. It's almost difficult to keep up with much of it. It's just going at a breathtaking speed. Just in the last few years, we've had just thousands of articles coming out, as you can see here, from PubMed.gov. If you want to learn more and you like to read the scientific literature, go for it. So 12,000 results just typing in brain gut. And that doesn't include, other ways of describing it. All right, so if you have a healthy gut, you're more likely to have a healthy brain, and vice versa. If you have a diseased brain or a diseased gut, leaky gut in this particular depiction, you're more likely to have the other. So these things go together, and they work very, very much together. This graphic is just to show you that how some of this works in terms of the layer of the gut. So if you start at the bottom, you can see that it says intestinal microbiota. So that's all your bacteria and the chemicals that the bacteria are making, and they're making just countless more chemicals than we ever thought possible. And these chemicals interact with the next layer up, which is the intestinal lining. And I guess you can see my pointer there. So depending on the interaction there, the intestinal lining can be interrupted. It can have inflammation. It can have different changes. And, the leaky gut idea is where some of these bacteria and chemicals start inappropriately getting through outside of the set pathways that the body already has set up. All right, and then the vagus nerve interacts with your gut lining as well, and you can see some of the metabolites, and leaky gut is related to your GI motility, which is the speed at which you digest your food and move the food along. And these tight junctions are these little things that hold the cells together. And so those things are all disrupted when you start having changes in your gut microbiome, but also, and the focus has generally been from the gut going up to the brain amongst doctors, but we're realizing more and more that the interaction is actually quite strong between going from your brain down to your gut with, again, the vagal nerve, and also through your circulation. So that's what this is depicting. Okay, so that was an intro to the gut-brain axis. There's certainly vastly more to say, but we'll just start on that. Okay, so let's look a little bit more at some of these chemicals. You can get overwhelmed with all the names and all the different things because it's literally a vast array of things. But I'll try to just summarize a few of the more key ones just to start getting you more familiar. So, as we're learning, healthy gut microbes produce chemicals from our food that send signals to our nervous system. Isn't that amazing? So, it's not just, we've always learned that digestion is, these different food products come in, and then you have enzymes that break them down. You have acid that breaks it down. There's some of the mechanical process of the stomach. And then it goes down into the small intestine, and those broken down components, leak into the bloodstream, and then your liver processes it further. And we never really thought about all the things that the bacteria were doing in there. And sure enough, the bacteria are playing a much greater role than we realized. Your stool is actually worth something. No, well, maybe not. I bet. They're doing gut or stool transplants now. So maybe your stool may be worth something. You got good stool. Yeah, they're doing it. It's an official treatment now. All right, so here's a list. You can see the list there. Secondary bile acids. Those are bile acids that are transformed from the main bile acids coming out of the liver, often stored in the gallbladder, and make their way down. And their job is to digest fat largely. And they're also involved with cholesterol metabolism. Short-chain fatty acids. We're learning that short-chain fatty acids are extremely important for your health, for your integrity of your intestines. Indoles. Indoles have to do with the tryptophan metabolism. We'll get to that in a second, but it's a basic chemistry structure that if you're taking organic chemistry, you should have an idea about. And there's a variety of different indoles. Toll-like receptor ligands. So toll-like receptor is becoming quite a famous receptor because we know it has to do with longevity and how long you live and your telomeres and so on. And then we mentioned neurotransmitters, and then the aryl hydrocarbon receptor ligands, which are sort of kind of new, but they include things like curcumin and indole-3-carbinol, which comes from your cruciferous vegetables. And so, what you eat, and if you eat those things, play a big role in what kind of chemicals are going into your body. All right, so our nervous system responds to the chemicals made by the influence of our gut microbiomes with many varied actions. So here's a few of the things. So the secondary bile acids very much impact your glucose metabolism, so your blood sugars, and your risk of diabetes and so on, and they have an influence on how you do with stress. So, some people have seemingly little stress that they start to feel in their system, and then they have much more dramatic effects in their body. Whereas other people can have dramatic stress, extreme stressors, and they have seemingly relatively limited effects on their body, so to speak. And some of that seems to be mitigated with things like secondary bile acids, the kind of bacteria that you have in there that are processing those bile acids. It controls the bacteria, and the chemicals are involved with controlling the secretion of serotonin by the enteroendocrine cells. So serotonin is actually made by the enteroendocrine cells. These are cells that they're not that common in the gut, but they're strewn throughout the whole gut. And they are very much involved with the signaling that has to do with your vagal nerve, and they're very involved with sensing and trying to figure out what's going on in the gut. And so they're the ones that make serotonin, and they take tryptophan, and we'll touch on that in a second. So regulate pancreatic function and appetite. It's funny to think that the bacteria in your gut have something to do with whether you're at risk of overweight or not. Isn't that interesting? Higher leptin production by fat cells, improving metabolism and reducing overeating. So there's some bacteria in your gut that can influence the fat cells in your body and stimulate your fat cells to make more leptin, which is a hormone that's very much involved in appetite control, and helps to make the food, helps you overeat less. Intestinal inflammation, permeability, so that's the leaky gut story. They affect the brain maturity of the microglia. So the microglia are supportive cells that support the neurons, and they help to mature them and help them function better. They influence the brain inflammation. So, depression has, traditionally been thought of as sort of something where you just don't have enough neurotransmitters, but we now know there's a very potent hypothesis that has to do with how much inflammation you have in your brain and whether or not you're dealing with a mood disorder from that reason. And they probably mix together very tightly. And so the gut bacteria influences that. And then, of course, the arterial narrowing issue with coronary disease and other diseases that have problems related to the narrowing of your arteries. All right, so let's look at one example here quickly. We don't have time to go through all the details there, or at least more of the details. So gut dysfunction and inflammation may contribute to depression, anxiety, brain fog. Brain fog seems to be related to that. COVID got a lot of press with that, right? COVID goes in your gut, messes up your gut, throws off the bacteria. You have a lot of diarrhea or whatever. Some people had that. And then they say, I just have so much brain fog. You hear anybody talk about that? Well, that's because there's a disruption that occurs in the gut, and that needs to be reestablished. And in my experience with patients is most of them, give enough time, things reestablish, and they start doing better. But sometimes we have to kind of help it along. So here's a few examples. Lactobacillus makes serotonin. So serotonin does also it's also made by the gut, and it's made by the enteroendocrine cells. And that's your body's serotonin. And also GABA. GABA is the hormone that makes you calmer, makes you have less anxiety. And so these things have a role to play. And some of the precursors that these bacteria make go up to your brain and influence it. So these neurotransmitters stimulate the vagal nerve in the gut, which sends signals to the brain. So we talked about that. So here's an amazing fact that I learned here recently. At least 600 metabolites are generated in the gut from tryptophan. So, there's a variety of different things doing that, but most of it's the bacteria. And depending on what kind of bacteria you have there, you have different kinds of metabolites. So I just put up an example of some of the things that have been talked about. This is certainly not comprehensive, but we're familiar with some of these chemicals: serotonin, melatonin. I mentioned the indoles, kynurenine. So there's different pieces there that we know influence our brain. So these are the ones that tend to have a little more influence on the brain: the serotonin, the melatonin. And the quinolinic acid. All right, so here's another depiction of the same thing. So tryptophan comes into your body. It's a commonly consumed food. It's in beans. Tofu is the highest source. Oats, nuts, seeds, et cetera, et cetera. So you eat it, and then depending which kind of bacteria get a hold of this tryptophan, it can go in a variety of directions. And so you can see from the top there, these arrows, and depending which bacteria there, you'll make different kinds of chemicals. And so this is a great depiction because it shows some of the positive and negative, downstream events that can start to occur. All right, so if you have a lot of lactobacilli, you're making the 1,3A a lot more, I3A, I mean, and then you start to improve your immune system, and it helps the immune system. If you are having Clostridia sporogenes, which is not, related to the classic Clostridium difficile diarrhea problem, you make IPA, and then it serves as a protection of your brain and helps with DNA damage and so on. So I guess that's in the way there. And it helps to minimize dementia risk over time. And then the other one here is indole. So indole makes a variety of helpful chemicals, and indoles we generally think of as healthy. Indoles come from cruciferous vegetables, I mentioned, broccoli and cabbage and a whole list of them, cauliflower, etc. And but if too much gets into the liver in the right setting, especially when people start to have some damage to their kidneys, this metabolite, indoxyl sulfate, starts to accumulate, and it starts to harm the body. So it starts to increase the amount of stress on the blood vessels, creating changes in the blood vessels that will eventually lead to things like heart disease and narrowing the arteries and dementia and strokes and so on. And then again, once you have fairly significant kidney problems, then you're going to really build it up, and we think it's part of the reason why people with kidney problems accelerate the narrowing of their arteries. So that's a negative aspect, depending on which kind of bacteria you have. All right, so here's a little more look at the tryptophan story. Sorry, that's in the way there. So you can see on the left there that you have dietary tryptophan, and then you have microbial tryptophan precursors that the microbes are generating. And then it comes into these endocrine cells, these enteroendocrine cells. And the enteroendocrine cells are involved with turning it into 5-HT. So that's 5-hydroxytryptophan. You can take that as a supplement, it's out there. And then, it goes into the bloodstream, and then the brain takes it up, and you can find the same chemicals in the brain. And so this establishes that, this is how it's done, and the body, the gut, is involved with the transformation of some of these chemicals so that you can have a better mood and a better situation in your brain. Okay, here's one other example. That was the first example. Second example is short chain fatty acids. So this is a really important thing. So the gut bacteria, depending on the kind you have, when you take in fiber, those gut bacteria begin to generate short chain fatty acids. But if you don't have the right bacteria, you don't make that much. And so short chain fatty acids are amazing for your body. They strengthen the gut microbes, they stop the leaky gut, they nourish your intestinal lining, they dampen inflammation, they improve the gut barrier function and the immune system. The short chain fatty acids go to the brain as well, and also are participatory in regulating appetite, reducing the blood-brain barrier permeability. So your blood-brain barrier, we used to think was solid, you could never break that down, and that's been totally destroyed now. And that's going to break down. Improve brain fog, improve learning, and so on, and prevent dementia, which is what the interfering with the formation of beta amyloid means. So, thank you. Some people are good at computers. All right, and so what factors contribute to this? Just stepping back for a second and looking at what contributes to the brain-gut axis disruption. So it's very broad, and there's a lot involved. How were you born? Were you born by C-section or naturally? Were you breastfed? Were you bottle-fed? How often have you had antibiotics? What kind of diet have you grown up with and have currently? What's your exposure to prebiotics and probiotics? And how much stress do you have, and how much stress have you been through? And we'll look a little more at that in the future. Okay, so this is just a graphic sort of looking at some of those things. You can see up here, breastfeeding, very involved with the baby. You can see, the kind of birth, the genetics, antibiotics. The average 2-year-old has already had almost 3 courses of antibiotics. The average 10-year-old has had 10 courses of antibiotics. This is traditionally, and I know we as doctors are trying to be more careful. I know I am. Your stress, whether you had pets, the kind of environment you grew up in, your exposure to dirt, infection in mom, stress in mom, how mom ate, those all play a role in what your gut looks like as you go through life. All right, so this is a fascinating slide, I think, because before 1996 we knew very little about all this stuff, and there's been an explosion. It's amazing. We used to think maybe there was only 400 different species in the gut, and then they did some more research, and by 2017 they were like, no, there's 2,000 or around there. And in 2019, they said the same, basically. But in 2021, they were like, no. There's over 4,000 species in the gut that are possible in different people. This is not all the same person, in different kinds of people. And they are now, multiple researchers are now on a quest to look all around the world, in everyone's stool in the world, at least samples of it, and try to find as many different bacteria as possible. And that is actually occurring. All right, so you might hear this term. I thought I'd introduce it to you if you're not familiar with it. Dysbiosis. So this is where there's an imbalance in the microbes that is causing some kind of problem. Usually, again, we're referring to the distal ileum, the distal small intestine, and the colon. All right, so your gut, my gut. So I mentioned there's a lot of difference. One type of bacteria that is 5% of a sample in one person could be 0.05% of another person. These are the 2 major phyla, which you'll hear about if you continue to show interest in this topic. These are the 2 major phyla that most of our gut microbiome comes from. And those who are sick, other bacterial phyla can dominate. So if you have an illness and so on, the routine phyla, which is the general broad categories of bacteria, can be totally different. Proteobacteria, you can have a lot of E. coli in there, and these other ones. All right. So again, the phyla is sort of, if you remember your biology, it's sort of a broad category, and you can dial it down from there. Okay, so this is interesting. So let's look at what makes a great microbiome. I'm sure this question's coming up. You're like, how do I get mine better, right? All right, so I just want to tell you a quick story about these Hadza people. I don't know if you've heard of them or met them before, had a chance to go over to Tanzania. Anybody been to Africa before? Several people. Okay, great. All right, so these people are in northern Tanzania. I almost said Nigeria. That's where I met my wife. Northern Tanzania, and they're nomadic. They're very nomadic, and they spend basically their whole day searching for food. That's their whole life. And amazingly, the average American eats about, 15 to 20 grams of fiber, something like that. They eat over 100 grams of fiber a day. They eat over 600 different varieties of plants. The average American, there's not great data on this yet, but the estimate is somewhere less than 50. Less than 50 different kinds of plants the average American eats. And I had a patient, I told her this info, and she's like, I think I eat less than 10. I was like, whoa, we need to work on that. So there's 40% more gut diversity than the average American in the Hadza people. So they have a dramatically more diverse gut in terms of the kinds of different bacteria. And my impression from doing this research and thinking about this is that, the ideal situation is where you have no one species dominating all the others. You have a broad array of different bacteria and species, ideally none of them evil. And, they're all participating in the process. They've been able to discover that when they have to change their food seasonally, so they're nomadic, they're searching around, and they, if you've been to Africa, there's a wet season and a dry season in most of the countries. And so during the wet season, they do well, they have lots of different food, but during the dry season, a lot of the food is not available that, in terms of the plant food, which, the thing that makes your gut most able to grow the healthy bacteria is fiber, which is only found in plants. And so they have to resort at that time to killing some animals. And so when they start killing the animals, the diversity of their gut begins to quickly shrink. And they just do it for a short period of time. And once the wet season starts again, they start getting their plants back. They go back to that, and the diversity returns. And they have extremely high short-chain fatty acid stool content. So I would expect this group to have very few issues with their gut and probably by implication their brain. Okay, so what makes what makes a great microbiome? Large variety of plant food, high fiber diet. Here's some of the other things that I think are important. Heavy exposure to natural settings. Small changes in diet, not enough. So there's several studies where they've just given people Metamucil or some of these over-the-counter products. They don't change the diet. They don't change the gut microbiome that much. You have to make substantive changes to go from a largely processed food diet to a largely plant food diet. You know what I mean? The gut bacteria decrease in diversity. We mentioned that, depending on how much meat you're eating and how little fiber you're getting. Rural is better than urban in industrialized countries, but not the case if you're not industrialized. So the urban people seem to be a little better off in the countries that are not industrialized, generally speaking. Obviously, the use of antibiotics, which we recommend to use sparingly. Additives. We know that there are a number of additives that are involved. In fact, I think I wrote that down here. I just want to share that with you. It's craziness. It's craziness. We're adding titanium dioxide, carboxymethylcellulose, polysorbate 80. There's just this whole list of different additives that are starting to be implicated that shrink and worsen the diversity of the microbiome. And we have them in a lot of our food. And we're probably going to have to influence the food industry by our dollar before they'll stop doing it, because a lot of those food additives really make their product more attractive to people. Many of these food additives are things that make a powder stay as a powder and less clumping. They make a some kind of sauce or something like that be less likely to separate. These are the kinds of things that are actually seem to be having a harmful effect on our gut as well. Toxin exposure. So there's a toxin called TCDD. It's a really long name. That's a dioxin, and it may induce autoimmune disease. They think that there's a connection there. So that's pretty serious. You get exposed to that dioxin, and then you end up with an autoimmune disease. That's pretty bad. And then unhealthy levels of stress. So here's an example with antibiotics. All right, so they gave the mice, the rat and the mouse, the antibiotics, and there's a bunch of research on this. And then they sort of watch what happens to their microbiome and check their stool and see which kind of changes occur. And you can see there's a whole bunch of damaging changes. They don't have as many short-chain fatty acids. Some of their inflammatory markers go up. They get more oxidative stress. They get damage to their blood-brain barrier. Their neuron development and their plasticity of their brain. So BDNF has everything to do with brain plasticity, the ability for you to learn new things and for you to adjust your beliefs and your habits in your head. BDNF. and a bunch of other issues there. So they found that the antibiotics changed the way the rat was interacting with his friends, and made them more depressed and had different kinds of issues like that. So, antibiotics can be a blessing, right? I mean, it saves people's lives on a daily basis, but we've got to be careful because it can harm too. All right, so dietary factors with positive effects on the microbiome. Let's see how we're doing on time. I guess we're getting low already. Plant-based diets, Mediterranean diets, any diet that's high in fiber is going to be particularly beneficial, and a lot of beneficial bacteria being generated there. Nuts have a very potent prebiotic effect, which basically prebiotics mean that it feeds the bacteria, and then the healthy bacteria grow up. Fiber, of course, we mentioned multiple times. Plant-based protein improves it. The unsaturated fatty acids improve it, and especially those that are making more short-chain fatty acids, the butyrates. And then polyphenols. Polyphenols are very important to increase the good bacteria and decrease the bad. All right, so here's a list of polyphenols. The spices, it turns out are very important for this. Sage, peppermint, cocoa, rosemary, spearmint, oregano, thyme, celery seed, capers, and berries, and olives, and so on. Very high in polyphenols. Blueberries and nuts and plums and olives and more berries and so on and so forth. So you can look this up anywhere. Just look up polyphenol-rich foods, and you'll get a whole list. Very easy. And I got this from nutritionadvance.com. We also know, and we don't have time to look into this because we're running out of time, but berries influence the pathogenic bacteria that's in our gut. So we know that there's a whole host of problematic bacteria that cause problems. Cranberries, blueberries have been shown to reduce some of the problematic bacteria, everything from Salmonella to E. coli, Pseudomonas, etc. Blackberries, raspberries, strawberries, Helicobacter pylori. A lot of people have this. About 20% of the world has it. Causes cancer, causes disease, multiple diseases, ulcers, etc. And blackberries help that. It suppresses it. Raspberries and so on. All right. So, and then the negative factors. The American Western diet with lots of processed food, lots of meat, lots of high-fat foods, is going to have a detrimental effect on your gut microbiome, generally speaking. And so it reduces the saturated fatty acids. The saturated fatty acids reduce the abundance and increases the pro-inflammatory type bacteria. And we don't have time to get into all the names today. Sweeteners seem to have a problematic effect sometimes. The sucralose seems to be the worst. Sucralose could induce a profile that's negative, and they're looking into that more. And then the emulsifiers, so these are the additives, seem to be causing problems, and this may be part of the reason why we're struggling in America, among other things. All right, so these are just some studies. Maybe I'll skip over these just because we just lack time. But basically, this study showed that among elderly people, when they substantially improved their diet into a Mediterranean diet, they had very, very good effects in terms of improving cognitive function and so on. When they took a group of obese folks and they gave them a nutritional education program over 8 weeks. And really increase their fiber intake, and it really wasn't that high. Whoops. It was only 15 to 19 grams. I mean, come on. It just really wasn't that much, but it improved their depression scores and so on, and improved the bacteria in the gut. Okay, so let's just look at depression for a second. So here are some of the bacteria that are abnormal when you're depressed. So Eggerichella, Salmonella, Pseudomonas, and so on and so forth. I can't even say some of these yet. They're so new. And here's the other ones. So, try saying all those fast 10 times. All right, and there's new ones coming out all the time. Here's an example of studies now coming out showing that if you substantially change the diet, you improve mood, significantly. So, this randomized controlled trial, 166 people, moderate to severe depression. They were either educated on a plant-centered Mediterranean diet or they were given social support. Though they had significant improvement in the Mediterranean diet, 32% on the Mediterranean diet went into remission. With their depression versus 8% in the social support group. Such a powerful change that the number needed to treat was only 4, if you know a little bit about statistics. So that's extremely low. That's extremely powerful. You can look it up, SMILES trial. This is an awesome idea. Did you know there's bacteria in apples? It's in the seeds and the white flesh. It's 100 million. 100 million bacteria in an apple. And if it's organic, it has a broader diversity of bacteria. If it's conventional, it's a more narrow diversity, which means it's sprayed. Desirable bacteria, right? Yeah, desirable bacteria. Yes. All right, so probiotics in the brain. So a lot of people are taking probiotics now. They're trying to improve the situation through pills and so on. There's not a lot of research on this yet. It's just starting to come out. It may improve, the problem that you get when you have liver failure that messes up your mind, and also may improve depression and anxiety. So we're seeing what kind of effects it can have, but I don't think anything's going to beat the SMILES trial. I mean, that's pretty dramatic. So changing your diet is going to be the biggest thing to improve your microbiome. Some of these probiotics is certainly something you can look at, but it's going to be a more mild effect. All right, so let's see, how much time do we have? We just have 1 minute, huh? Yeah. Right. Sure. Yeah, no problem. So we're out of time? Are we out of time? I just have a few more. I have a few more slides just on stress, and I'm finished. So, but yeah, if you need to go, please go. We don't want you to miss class, and so on. But this is actually the climax of the talk because stress is so important when it comes to gut. Yeah, don't get stressed. Don't be late. All right, so we'll just cover a few brief items here. So we kind of looked at some of this. We know that stress worsens inflammation in the gut. It worsens leaky gut. It worsens the dysbiosis and can mess up the motility, which is how fast things go through. It can make you constipated or give you diarrhea. All right, so those are the things that are listed in this graphic. Here's an example from inflammatory bowel disease, where people are having a lot of stress. It's messing up their gut and their microbiome, and it changes the kind of releases of the neurotransmitters, changes the immunity, disrupts the barrier, which is also known as leaky gut, and changes. All of this gets changed, and these cumulative changes increase inflammation in the gut and can lead to inflammatory bowel disease, which is very hard to deal with and very difficult. Let's just skip this one. Let's just skip it. So, yeah. Okay, so you're okay with, okay, I'll go over it. Okay. So this is a great graphic that kind of pulls it all together. So you can see up here that this is your brain, and then this is your bloodstream, and then this is basically your gut lining, okay? And then here is the sort of the bacteria and some of the different things that are occurring, and this is your food down here, okay? So they're just trying to bring this all together to show the influences. You can also see your vagal nerve here. And so, some of the things I haven't brought up yet, but if you're interested, you can look into this. This is Birding from Advances in Nutrition 2021. But these things influence each other. So short chain fatty acids we've heard about. It influences the gut lining and also influences the brain. We already heard about that. The kind of diet you eat plays a role in that. Your polyphenols we've already looked at. Fermented foods, I haven't talked about that yet. So fermented foods, it turns out, is pretty important, and this is going to be helpful, especially in people who are actively suffering. So sauerkraut, that's my German background. Yogurts, different kinds of yogurts. There's a whole list of fermented foods depending on the cultural background. But there's a variety out there. Kimchi and so on. These fermented foods may, if they make, most of them do, healthy bacteria like lactobacillus, they will help your gut and help restore some of the things that have been lost. All right, and then the Western diet. The Western diet produces lipopolysaccharide. Lipopolysaccharide is what bacteria make, and it's a very dangerous chemical when it gets into the blood. It basically is the chemical that gives you sepsis. But it's usually in relatively low amounts in this kind of situation. But when it does start to rise, it starts to mess up your body. All right, so here's an amazing point that I still can't get over this. 80%, up to 80% of folks who have an autoimmune disease report uncommon emotional stress before it came on. I know this occurs with cancer too. I personally saw this. There was a gentleman I cared for before I got into med school. I was a caregiver for him. And he had gone through the most stressful event of his life, where he was estranged from his father. His father died, and he was the oldest child, and he had to go deal with his father's, kind of house and all the stuff, and try to get that all figured out. And he said it was the most stressful thing he ever went through his life. And about 3 months later, he was diagnosed with cancer. And so stress is important. And very likely he had dramatic changes in his gut microbiome that was part of that story. Early life trauma. Early life trauma, I think, is not tended to adequately. Studies show that a majority of people with irritable bowel syndrome have some kind of early life trauma that perhaps resets some of these relationships and makes it so that bowel pain comes on easier. Early adverse life events or traumatic experience that occur during childhood. It could be a variety of things. It could be relational problems, severe illness, death of a parent, for example, abuse. And if you want to know if you have had some of these things or you think you might have, go to stopabusecampaign.org and take the test, adverse childhood event test. And look into it. It's pretty important, and these factors play a role now. All right, so what might you do if you go see a doctor and you're having something that you think might be related to your gut, or perhaps even your brain? We'll do a history. We'll check you over and make sure there's nothing else going on with various testing, and we might do more invasive type tests. If necessary. But if everything's negative and it looks fine, so the doctors say, then they'll often label it irritable bowel, right? But that doesn't mean everything's fine, right? We've learned from this topic and this talk that everything's not fine, that things are thrown off, and now you have some of the tools necessary to start improving them. Okay, so let's look a little bit more about stress. So stress is a bad thing, but eustress is a good thing. So positive reaction to stress generates within us a desire to achieve and overcome a challenge. So that's what university is all about, right? Your teachers set up a challenge for you, and now you got to accomplish it, right? And so that's eustress. If you're, it's kind of like marathon runners talk about being in the zone. Has anyone been in the zone while they're exercising? You just feel so good. That's eustress. All right, so it's in the flow, the runner's high, and so on. That's the good kind of stress. That's stress that helps your body. Things like this help your body, improve your stress, right? Music, relationships with family that are redeeming and helpful. Vacations, people, vacations. What's that, right? Avoiding overwork, excess commitments, weekly Sabbath rest, healthy financial decisions. I mean, there's so many things that can throw off our rest, right? Sleep, diet, exercise, prayer. I'm increasingly experiencing the wonders of prayer and how it helps stress. I encourage you to explore it more. A healthy thought life. Some people struggle with that a lot. Healthy relationships can be a big problem. Managing time. Discontentedness is a major issue with messing up your gut. Addiction, big problems there. And valuing the creator, not the creature. And looking to a higher power, so important. So this is me and my daughter spending time together when she was little. You just long for those experiences, those redeeming, valuable experiences that improve your stress. Spending time in places like this, Cascade Head, Oregon, on the Oregon coast. I mean, it's absolutely amazing. We got places like this over here too. Here I am, enjoying the scenery. It's just amazing hike there. Here I am with my father. Spending time in natural settings like this. Very good for your gut. Very good for your brain. Are we doing enough of this? Are we, chronically deprived? Okay, so that finished the stress section. So we're basically finished the talk. Here's the summary slide. How to obtain a healthy brain gut access. Sorry, I missed a typo there. Eat a large variety of plant food. Be breastfed. Birth naturally whenever possible. Minimize antibiotics. Eat a large variety of plant food. I mentioned that. High fiber, low meat. Natural settings. And small changes are not enough. And avoid stress. Let's maybe close with prayer and we can let you go. Dear Lord, these are major issues that affect all our lives. And as we seek to improve our health and seek to improve our brain function and so on and so forth, give us the wisdom, give us the insight on how we can improve our own health, improve our bodies, realize that it's such an amazing interdependence that we have on nature, and that help us to embrace that and give us the insight that we need to improve and to help others. In your name I pray. Amen.